Hello and welcome to Conversations with Clinician Researchers. My name's Prof Thomas. I'm the Research Education Lead for the Tropical Australian Academic Health Centre known as TAAHC. Today we're talking with Amy Brown, who's a radiation therapist and a research fellow with Townsville HHS. Hello, Amy.
Hi.
Hello. Tell us a little bit about your role in Townsville.
Yeah, so as you mentioned, my clinical background is radiation therapist, but I've moved into a research fellow role and I work across the Townsville Cancer Centre at Townsville University Hospital. And so I work with clinician researchers and investigator-led projects across radiation oncology, medical oncology, hematology, and palliative care.
How did you get interested in doing research from your clinical role? Now you've morphed into a research fellow. That's a long way from clinician to sort of full-time research fellow. How did you do that? What sparked your interest?
I fell into research. So years back when I had just finished my first year of clinical practice, our manager asked for some volunteers to help on a pilot study. So a really small research study in radiation oncology. And I put up my hand and that's how I found out that I loved research. And it was really through that whole process and then at the end seeing actual practice change as a result of the pilot study and the studies that followed, that really sparked my interest in research. Yeah.
Nice. Do you remember, I mean, I understand the idea about, you fell into it. And do you remember a particular moment there's something like, when you talked about, you saw the practice change. Do you remember a moment that made you do an aha?
Yeah, it was knowing that we were implementing this in practice. That was the aha moment. And then that is always reinforced when now when I talk to our participants in research and particularly doing some qualitative interviews with patients. And when they share their perspective, that's when it just cements it for me, is that we're making a difference in these people's lives through treatment, through research, that just engages me all the more in research, hearing from those patients and the participants and their perspectives.
That's neat. People often talk about being a clinician and being a researcher sometimes feel like two separate roles, and that time is really challenging to navigate. How do you navigate that tightrope between clinical work and potential research work?
So I think firstly, I've been mentored to research as close to your clinical practice as possible, because you're always then going to be able to integrate your research and your clinical practice. Also, really understand what you can achieve in 5-minute blocks, in 50-minute blocks, in 5-hour blocks, should you ever get the luxury of a 5-hour block amongst your clinical workload. So that's what I certainly practiced when I was full-time clinical, and now I try to encourage in those that I'm working with, is you can often get a little bit achieved in 5 minutes. So when you do have that spare 5 minutes in a day, think about what you can work towards in your research.
How did you learn to do that? That sounds fabulous. How did you learn to do little chunks of research at a time?
I think it was necessity, actually. Knowing that I, for example, was collecting data on some radiation oncology images, that if we were waiting for a patient to show for an appointment and I had that 5 minutes, I knew I could collect that one image. And if I did that one image per day for a couple of weeks, then I'd get my data collected. So it was necessity.
Yeah. Necessity is the mother of invention, I guess, isn't it? Now I know that you, sounds like you started your research when you were a clinician, but I also know that you have now finished your PhD and you are waiting anxiously to see how that goes. But do you think, so people watching this, some of them might be interested in doing a PhD, some might not. Some people watching this might be just interested in knowing a little bit about research and how to get there. Do you think that doing a research degree like a PhD or a master's is necessary to conduct research as a clinician?
I don't think it's necessary. And in fact, I would encourage clinicians before they enroll for any high degree research is to just get involved with some local research and see if it is something that sparks you, because you need the dedication and the commitment to see a high degree through. So I would suggest just get involved in some research that's happening first and try it out, see if it's for you. But then a PhD for me has been such a rewarding experience, and it was through my PhD, while I had some quantitative research experience, I had never done anything qualitative. And so I really got to put my L plates on in my PhD and do some qualitative interviews in a mixed methods project, and do that in the really supportive environment of a PhD. So for those who are really engaged in research, I think it's something to definitely consider and explore, because you do get that support and you get to put your L plates on. And for a clinician, you know, often clinician researchers are quite experienced as clinicians. And so the opportunity to then expand their knowledge and their learning through a higher degree is a great opportunity. So that's my perspective on that.
Yeah, thanks. I like the L plate analogy. That's really cool. What keeps you motivated? It's a long journey, research. It's sometimes hard. It's always hard, but what keeps you motivated?
I think I've already alluded to. So whenever I get to talk to a participant or a patient, that always motivates me, even if it's just approaching them about a study and talking about the study. And so often I hear back from these participants that we're approaching is, look, I'm happy to help. If this will help the department, if this will help future patients, then I'm really happy to help. And so that really motivates me, is they're really altruistic point of view. And then a little motivation for me personally is I have a little reward system for myself. Whenever I get a milestone, I buy myself some jewelry. So that's something else too, is have a reward system, something that helps you and make it meaningful. So whenever I get a publication, I buy myself a little piece of jewelry, or, you know, so a reward system is also good, because like you said, it can be hard. It can be a long journey. So having those little perks along the way is also something that I find a little motivating as well.
I love that. I want to see all your bling sometime, because I think you've reached a lot of milestones. That sounds really cool. So lastly, just before we finish up, what was something that you've mentioned while we've been chatting that you would really like people to hear again? I guess this is a different version of what's your take home here, Amy?
I think my take home would be, if you have an interest in research, is find a way to try it on. So get involved in some local research with somebody who's got experience who can mentor you. And you know, you don't have to go on, like I said, and do a high degree in research, but just try it and see if it's for you, and see if you too get the motivation of talking with patients and you know, hopefully helping their health journey, whatever that is, in through research. So give it a go.
Sounds great. Nice talking to you, Amy. Thanks heaps.
Thank you.